All right. Hello. Hi everyone. How are you? Yes, you are most welcome to our Facebook Live. I'm Karine, your host this afternoon, and we'll be talking about joints. Now I have a live audience and online. I think I will just focus on the physical audience, and then you follow along. So joints. Most people when they hear joints, they go like, this is for old people, senior citizens. Not so? Yeah, they don't feel like it concerns us, the young people. But the truth is, it actually concerns us. We need to know how to take care of them so that in the future we avoid some troubles that those who went ahead of us didn't know, were not aware of. So that's what we are going to talk about today. So joints, what are joints? A joint is a connection between two bones. Wherever your bones, every bone in your body except for the hyoid bone, the bone in your throat, but all other bones, wherever they meet, that part is called joint or articulation or sutures for the skull. We are going to see. So those joints help you to do movements. You can wave goodbye, you can wiggle your hips, you can walk, you can dance because of the joints. If it were not for bones, you'll be like a statue, stiff. Isn't it amazing that God thought about it and gave us joints? Yes, so the more movement you can do, it means that particular joint is the higher risk. It is at a higher risk. Now, for example, our hips and our shoulders, that's where you can do most of the movement, all the movement actually. But all other joints you can't. You can go backward, forward, upward, downward, you can rotate, but all other joints you can't do that. So it means that the worst injuries will happen at the level of the shoulders and the hip. You know, when I was a young girl, I used to play basketball, and I would hear people have dislocated their shoulders. I just thought it must be like awkward until I saw it. The girl dislocated, and she was like, this is my 5th time. And some of them were so used that they would just do, it's actually a medical emergency. They're just supposed to rush you to hospital. But I guess she was so used to that, and she just did a movement, and it went back. And we continued playing as if nothing had happened. I was like, huh? Yeah, so dislocation, that kind of thing can happen. And that's why you need to take care of your hips and the shoulders, because all the worst thing can happen from there. So in total, you have about 300 joints in your body. 300 joints. Yes, about that. You see, the human body is amazing. And we have mainly 3 types of joints. We have the immovable joints. That's like your skull, the bones in your head. They are tightly close together, and the joints in between, they are very small. They are called sutures. Those ones, they can't move. They are tight in a way that they can't move. Then we have the slightly movable joints, like your spine. They are also tight together, but it allows some sort of movement. And then we have the freely movable joints. All other joints in your body are freely movable. Like I was saying, your jaw, you can eat, your fingers, your knees, you can bend, all that. So the hip is the largest joint in your body. It carries all your weight. If you are 70 kilos, all that weight is seated on your hip. You can dance because of the hip. You can walk. Every time you take a step, that whole mass is sitting. The spine carries the weight, which is the upper part of your body, but the spine sits on the hips. Yes, and that's why for overweight people, that stress is felt on the hips and partly the knees, because they are distributed. So the knees suffer first. Yes. So to understand the joint and what happens there, we need to understand the structure of the joint. It is, let me say, it has about 5 major parts. The cartilage, you've heard of cartilage. every bone, if this is my bone, at the end of every bone, there is a smooth tissue. It's called cartilage. So every bone, if these are two bones, there's cartilage here and here. So when they are together, they don't rub against each other. And then we have ligaments. Ligaments, they join two bones. So it's like an elastic band, which is very tough. It comes from here up to here and it holds the joints together. It connects the bones together. Those are the ligaments. And then all these parts, the joint, is surrounded by a fluid. It's called synovial fluid. That fluid is very important because, first of all, it cushions the whole part, the bones, the ligaments, everything. But also, it nourishes the bones. It has some nutrients in there which are crucial for all those parts I'm talking about to grow, to be healthy. And then we have tendons. Now, you know that our bones are covered by muscles. These muscles are attached to these bones by some tiny part called tendons. So the tendons attach those muscles to the bones. And those tendons are also in that whole part, the joints that we are talking about, okay? Yes. So when you hear about different joint conditions, it's one or the other which has been damaged. Either when you hear, I know most people know about arthritis, right? Actually, when we talk about joints, everyone thinks it's arthritis. But it's not. Arthritis means that the cartilage was broken. Remember the cartilage? Yes. It was broken. So when it's not there, these bones are now rubbing against each other. Imagine putting two sticks together. Like stones, actually. It is very painful. Now imagine it's in your body. It's painful, the pain alone, and then it starts swelling. It's stiff. So some people reach a point where they can't even walk because that cartilage is broken. You imagine maybe the tendons are injured. They can be injured or inflamed. Most of us know that this tendon at the back of your leg, Achilles tendon, right? Yeah, so like athletes, you hear they have injured it. It's so painful. Yes. For example, the ligaments. We talked about the ligaments. They can also be torn, especially around the knees. They can be torn. And all those are joints conditions. And if you know ahead of time how to take care of them, then you may prevent all this from happening. I've talked about dislocation. When a bone is dislocated, it means that the joint will also be affected. Those tendons, those ligaments, everything around there will also be affected. Or a bone is fractured. Like maybe it's the humerus, maybe I had an accident and it's broken. When it's protruding like this, it can easily damage muscles, tendons, ligaments. You understand? Yes. Sprain, those are the torn ligaments. You've heard of, I had a sprain. Those are the torn ligaments, right? Yeah. So, the synovial fluid, we talk about synovial fluid. That one, as we age, actually we produce less and less of it. So when it's not there, it's also a problem. It's wearing off. So you may have to replace it. We are going to see how to take care of all that. Now that we know all those conditions, what can we do? One, these are supplements. Let me start with the supplements. Now, whether you are young or old, the best thing you can do, the favor you can do to your joints is take supplements. A diet full of antioxidants. For example, garlic. Garlic is a very good antioxidant, very good for joints. You start now, not when the arthritis has come, to nurture those joints. the body needs garlic, and it helps maintain healthy levels of the synovial fluid. It can actually increase, it can maintain or even increase. It can increase it when it's low, when you're taking garlic. We have omega-3 fatty acids. These ones, they also nourish the joints, and they keep also the synovial fluid healthy. So you start when you are young, taking these supplements. Yes, actually they say that 1 to 3 grams, just 1 gram of these fish oil daily, on a daily basis. Now it's about being consistent, not taking once and then I take next. No. Be consistent. If 1 gram of fish oil daily can reduce the intensity of joint symptoms like morning stiffness. Most times the stiffness happens in the morning because we've been sleeping for 8 hours. We are going to see why it's not good to be immobile for long. Yeah, so for people who are already struggling with joint diseases, this fish oil can help them to reduce that morning stiffness, to remove that pain, the swelling we've talked about, the inflammation. Yeah, so our fish oil is the best. We ensure quality, and it's a good ratio. It actually does not just target your joints, even your heart, because joint disease actually can be related to heart diseases later in life. So you tackle 2 with 1 product. The heart disease, it means that this increases the blood flow when you are exercising. We are going to talk about exercise. When you are exercising, it helps the blood flow in your body. Then you need calcium. You need sufficient calcium. When I talk about sufficient calcium, it means 1,000 milligrams of calcium. In your diet, let me be bold, it's impossible to achieve that. Yes, so it's better you get supplements. I know people ask a lot about but why supplements? Why should I really be on these things? They call them these things, these tablets, because this is like the product, the nutrient itself that you are looking in that milk, in that cheese, in that yogurt, because you can't get it in enough quantity. Maybe when you get home, get that pint of milk, read how much calcium, or that water. It's ridiculous. You will not believe yourself. And yet you need 1,000 milligrams of it. So this is packaged in such, and calcium, the body can't produce calcium. It can't. You have to get it either in your food or in supplements. Right? And the other thing is, when your calcium in your blood levels is low, guess where the body will go to get it from? Your bones. Yes, when it's low, it goes in the bones. It draws calcium from there, because your blood calcium has to be enough. It's the one which is urgent. So your bones will suffer. I've seen, most times I give this example, women in the village, they've given birth to 5-6 children. Each time you give birth, you're losing calcium. And the calcium has to be there. So they go and get it from your bones. So you find them losing teeth, their bones are fragile, they're always complaining about, 28 years old, complaining about joints. You wonder why. That is the reason why. Yeah, so get enough calcium. And it's not just the village, even here it's happening. Yes. And then another interesting about, I want to insist on calcium, by the way. Then calcium, when you take it, it's not just taking it. Now, when you take it, it's not easily, that our digestive system, the way they were made, they are very poor at absorbing calcium. So it can go as this 1,000 milligrams, but it will pass as if it's just a pipe. So you need vitamin D to absorb that calcium that you need on a daily basis, right? And when you are not taking both together, the good thing, this is already combined so that it's easily absorbed by the body. Yes, so when you are taking calcium, you need that vitamin D as well so that it's absorbed in your body. I've come when I've already swallowed my calcium. Yes, me, I'm careful. I start early, I've told you. And so you better also start early. Yes. Then we have something called your ligaments, the tendons, the cartilage we were talking about. They are made, they have some substances inside of them. They are called glucosamine and chondroitin sulfate. The cartilages, the tendons, the ligaments, they are made of that substance. And so as you age, as you use them, they wear out. Those substances keep reducing in there. So you have to replace them. And this is a substance. It's a product designed especially for that. It has chondroitin and glucosamine sulfate in there. So these two, they are produced by the body, but they are also available as supplements. You can get them in this drink. It's called Forever Freedom, to free your joints. So when you take them, when you take them, it increases the production of cartilage. So I told you, as we age, the cartilage is wearing out. The tendons are becoming. So when you are taking this, you are feeding your cartilage. It is producing that cartilage and the fluid around the joint, the synovial fluid. It also has that glucosamine and chondroitin sulfate. So they prevent the breakdown of those tendons and ligaments as well. And it's very good for joint pain. Actually, they say this one serving is an equivalent of 1.2 grams of Brufen. It's a painkiller. You've heard of Brufen? Yes, it's anti-inflammatory. And it's amazing. You know, when I talk about these things, this is science. Yes. So you just take 100 mils of this on a daily basis. 100 mils is like 10 covers. Of this is about 10 mils. So 100 mils of them on empty stomach, and you're good to go. Your joints will thank you. Then we talked of the synovial fluid. It has a substance called hyaluronic acid in it. That hyaluronic acid, until recently, before, it was only available in injections. So people had to go and get injected with this substance. So it's amazing that Forever has found a way to package it, yes, in form of tablets. And this is usually given to patients who the pain is intense, they can't respond to any other medication. So they have to inject that hyaluronic acid. So we have it in a tablet form. When you take, you get that amount that you need on a daily basis. I have a testimony actually about this. We had a friend who she was also suffering with arthritis, and she was told about the product, so she started taking. But somehow she didn't take this, and the pain became intense, and it was so bad. So later we discovered that actually we have Active HA. We told her, you need this because it's very good with patients who have too much pain, and she would even get admitted for that. When she started, she could not let go of it. She said, oh my God, I wish I had discovered this, that time, a long time ago. And now we were scared that she was actually probably getting an overdose. She liked it so much, she was like, I just need this. Someone who will order like 2 in a month, you're like, are we safe? Yeah, so it's amazing. Active HA. By the way, it's not just for joints, it's also Active HA, hyaluronic acid, is found in the fluids, that's synovial fluid, but even the fluids in the eyes and the fluids in your body. So when you are taking it, your skin looks amazing. Your eyes, it works on so many parts of your body. So if you knew it, you would actually, it would be on your list. Yes, Active HA. And the effect lasts up to 4 to 6 months. 4 to 6 months. Yeah. All right. So those are the supplements. Let me talk about this. This is vitamin C. Your joints need vitamin C. We talked about antioxidant. This is the most powerful antioxidant you'll ever find in the world. So vitamin C, in fact, many people, when you hear of joints, they are being fed on vitamin C. So you need vitamin C for your joints. Yes. So I think we've talked about all of them. This, I'm going to come to it as we talk about exercise and all that. Now, when you want to take care of your joints, you should actually avoid sitting like how you are doing now. Less movement means more stiffness. I've told you, you have ever, when you wake up in the morning, how do you feel? It's like you're a bit like a tree. You have to first do this and that. It's like your whole body is frozen. Yeah, that's the stiffness we are talking about. So avoid sitting in front of the TV, doing games, computers, phones. If your job doesn't allow you to stand, whenever you receive a phone call, use it as an excuse to stand. Pick it while you are standing, walking, right? You need to walk. Your muscles, when you are not using them, they shorten. We call it atrophy. So your muscles need to be used, and the more muscles you use, the better, because they will support your body, your ligaments, all those structures we've talked about. Yes. So let's try to walk. When you are sitting or standing, try to be in an upright position. Don't be seated like this. Or you stand like... No, try to be upright. Right? Yes, because remember, you're putting your weight. When you do this, you're putting the whole weight under one joint. So it's better when it is distributed. If I'm picking something down, don't bend. You would rather squat. Okay? Use your big muscles, like your abs say, to carry. If you are carrying a backpack, don't use one shoulder. Use both shoulders. Try to distribute the load. Yes, when you squat, you're using your abs. And yet, if you do this, it's the spine which you are injuring. Right? Your fingers, if you're trying to carry, try to carry. If I have to carry this, put in a cavera, then carry. Don't try to do this. You're bending your joints, you're injuring them. Okay? So take care of your joints, how you handle things. Right? Bend your knees, not your back. Your knees are very strong. Remember, they carry your back. So try to use the hip. We say it's the strongest joint. You try to use the hip in whatever you do. Okay. Let me talk about exercise. Exercise. Now, people think that people exercise because they want to lose weight. No. You exercise because those muscles need to be developed. All of us need to exercise. Yes, in the morning, every day, by the way, I exercise. And you don't need a treadmill. You don't. Just put YouTube. Walk, exercise, walk out. They are there. You just do in your bathroom. I finish my 6,000 steps as I'm talking. Yes. So the exercise build your muscles and they keep your legs strong. And strong muscles will support your joints. The joints will not be the ones to do the work alone. The muscles will help carry that weight. The ligaments are stronger. The tendons are healthier when you exercise. So if you can do at least 3 times a week, the tools are here with us. YouTube, just put. Yes. And when you are doing the exercises, try to choose an exercise routine which involves all your joints, the knees, the hips, they are there. When you scroll through, you will see. Yes, try to use all of them so that your body is in harmony. Right, and they are saying that especially try to develop the stronger muscles, the abdomen, the back, the knees. The back muscles help you keep your balance when you are standing. If you are going to be standing most of the time, you need your back. So it's better you develop it, starting now. Injury. When your joints are injured, you use ice when it has just happened. Don't go straight for this heat lotion. No. First use ice, and ice shouldn't be wrapped directly on the skin. Wrap it in a towel or a cold pack and apply there. Now, when the crisis has passed, this is amazing. Heat lotion. This is eucalyptus, aloe, and when you rub it there, it has a way it can soothe that pain. Yes. It eases the joint pain and the inflammation. It acts in very quickly. I remember when we were with Josephine in Greece, I sprained my ankle. It was so bad, and they actually had to look for a doctor. There was a doctor assigned to the FBOs, and it was going to be just a whole process. But and Forever is amazing. When we were there, they gave us in your room. You have moisturizing lotion, sunscreen. You have this. They had given me this. I had not carried. So it was amazing that I just rubbed there. By the time we finished lunch, I was walking back to the training. And I know Josephine also loves this this lotion. It's simply amazing. It's a must-have in every household. Yeah, heat lotion. So it's eucalyptus oil. And then keep a healthy weight. The more you weigh, actually, I want us to do these math together. For a pound is about 0.5 kilos. For every pound you add on your body, you add 3 to 4 times that on your knees. Do you understand? If I've added, let's say, 5 kilos last year, it means that on my knees, I have put 15 kilos of pressure on my knees. Do you understand that? So when you are telling people, take C9, you lose about 5 kilos. 5 kilos means, and by the way, this is per step you take, not just one off. It's per step you take. I told you I've done 6,000 steps. Okay, on average, a person does how many? Maybe we count 5,000 steps per day. 5,000 steps per day. 15 kilos for each step. How many are those steps? Let's count together. 15 steps. Mm-hmm. 15 kilos times 5,000 steps. How many? 75 per day. Now in 1 year, times 365. Can you imagine? You've put 27 million kilos of pressure that whole year on your knees. So when we tell people lose 5 kilos, it means a lot. It means 27 million kilos of pressure off your knees. Do you understand? Yeah, so we should actually recommend C9 with our head high up. And you add that, since you know that now, you have that knowledge. You calculate for them. Let's calculate together. So you are doing a favor to your knees by losing weight, right? Yeah, so excess weight adds stress on your joints, especially the knees, and causes pain. So if you're losing weight, I've just shown you how you can actually take pressure off your knees by losing just an extra 5 kilos in 1 year, not even a month, or 1 year. Yes. So if you've ever tried to lose weight just to look good, now do it for the sake of your knees, for the sake of your health. Yes. Yes. So I think let me stop here. It's 2. I just want us to encourage us to keep healthy, exercise, get fit. Don't think getting fit is for people who want to lose weight. It's for all of us. Yes. Take supplements. By the way, I have taken this. It's very nice. It has an orange flavor. Take once in a while, just to feed your joints. But Actic C, this is of course a must-have in our household. So now you know it's good for joint absorbency. Active HA, very good. The ladies, you love your skin. You fall in love with your skins again when you use Active HA. So these calcium, I told you I came when I had already finished taking my calcium, especially ladies. You know, for us, you're losing blood every month. You've given birth to 3 children. We go through so much stress that if you don't take care of yourself, of your body, you will just realize when you're falling in pieces. Yeah. So let me encourage you as I encourage myself. Let's take care of our joints. Thank you.